Here we go. Okay. So I'm going to welcome you all here today. I thank you so much for taking time out of your day to be with us. Let's get started with a little housekeeping. So we are scheduled to run till 12:30. I intend to honor that like my life depends on it. So we are going to take a break around 10:30 for about 10 minutes. But what I want to offer is if you need to take a bio break, please feel free to turn off your camera and do so. I would like to ask that if you're not speaking, that you keep it muted. Keep your computer muted. And if you have a question, you can certainly raise your hand or you can post it in the chat. We are going to cover a lot of dense information. There are some questions asked throughout. So if you can record your question when we ask for questions, maybe bring your question up then. If it's something that you think is really relevant to the topic right in that moment, please do raise your hand. And if we have time, we'll select you and give you a chance to answer those questions. But we will try to get through the material and get the questions at the end. If the information is so dense that we don't have a lot of time for questions, what I promise is that we will make time at another time to get your questions answered. So your questions are valuable. We want to respond to them. But we are trying to cover a really dense body of information in this training. I would ask also, if you wouldn't mind, to turn your cameras on, because I do want to connect with you, to see your faces, to connect and let that inform me of how to pace or respond or, manage the session. So looking at a bunch of names and pictures doesn't help me do that. So as you can, if you would kindly make your picture available, I would certainly appreciate that. And then, as I said, if you need to break away, feel welcome to turn your camera off and take care of your bio break or whatever it is that you need. So we're gonna get started. I'd like to, we had some issues. So you notice in the email that I said, we're going to need to be patient with each other and understanding and present, because I've never tried to use all of the tools all together as we're doing today. So I am asking for your patience and understanding. We also had some snafus with getting Judge's video pulled together. So he happens to be on the call. I'd like to give him a couple of minutes to do his welcome in person. And then we will make sure that we make that available digitally at another time. So Judge, if you would go ahead and do your welcome, since we weren't able to get your video set up, I'd like to invite you to do that now.
Well, again, welcome everybody. I'm really glad to see you here today. Most importantly, I'm glad to know that you are the people who are on the ground doing the work. And it's very important that we have a good understanding of what the Louisiana Prisoner Reentry Initiative is and the contents of the Louisiana Prisoner Reentry Regulation. And most importantly, we want you to understand how much of a paradigm shift this is. In the old model, we were simply trying to connect people to the community resources in the various communities. However, this paradigm is very different in that we are actively engaged in reach, so that we can work with the incarcerated people as they develop their reentry plans, so that we can help them develop a feasible plan. We need to have a good understanding. They need to have a good understanding of what the programming is available in the institutions where they are. We need to be encouraging them to consume those rehabilitative programs. But of course, You know, many of our people are not in institutions long enough to complete that programming. And so thus they are returning to our communities with a lot of unmet needs. And we need to help them understand that and help them understand the kind of resources that are available to them in the community and get them to commit to consuming those programming that's available in the community once they are released. But of course, we know they're going to need a lot of support, because in that first 6 to 9 months, that is traditionally when folks get into trouble and are returned to an incarcerated state. And so this means that we need to have a lot of collaboration between the incarcerated people, the formerly incarcerated people, the probation and parole officers, and our reentry coalitions in each local community, and the service providers in each of the communities. This is intense collaboration. We're working together concurrently at the same time to develop a feasible reentry plan and encourage the returning citizen to actually work to implement that plan, which of course will typically result in them changing many of their attitudes, their beliefs, and of course their behaviors. We are trying to help them become more pro-social. And of course, we're also helping our community develop the capacity, a greater capacity, to reintegrate these citizens as they return to us. So thank you for doing the work. Thank you for coming here, showing up to get the training. Have a great day.
Thanks so much, Judge. So Judge serves, as you well know, as the chair of the LAPRISTA Steering Team Association, and we are so grateful to have him here today. And I'm grateful that you guys are here today. I was really serious about looking forward to seeing your beautiful faces, because we just don't get a chance to interact enough in our new paradigm. So I am here for you, and I just want to welcome you from the bottom of my heart to be here today. And I'm so excited. I am so excited about this work that we're doing together. It is such a tremendous, sacred charge to be working on this issue in Louisiana, given our wonderful global reputation. And so I think it's just important that we get excited about the opportunity to work on one of the biggest challenges that our state has to face, and how important it is that we're going to be helping turn lives around, give people paths to success and abundance and prosperity. That is awesome, and I'm just excited to be here for it, and I hope you're as excited as I am to be here for it. So welcome, welcome, welcome. We're going to dive in. So this training, as you may know, is one of 5 trainings developed from a needs assessment, and Megan Shipley did over 60 hours of interviews with some of you guys, community coordinators, RPMs, community co-chairs, even some jail co-chairs in the spring of 2021. So this first training focuses on a framework for successful reentry from prison. This framework supports the department's prison reentry regulation and the Louisiana Prison Reentry Initiative model on which the policy is based. So the mission of Social Works Institute, which is the organization that I lead, is to break the cycle of violence, abuse, and incarceration by preventing childhood trauma and healing adult survivors. And that's how this work meshes with why we're here. So we're using the collective impact model to incubate the LAPRISTA Steering Team Association. And we call it LAPRISTA. And my joke is, if you get really good at this, you become a LAPRISTAnista. So LAPRISTA is a statewide member-led association that supports and grows the local LAPRISTA steering teams into self-directed community organizations dedicated to evidence-based approaches that will ensure the best outcomes for Louisiana citizens returning home after prison. Now, I know that's a mouthful, but it's really what you guys are already doing. So LAPRISTA promotes that the key to recidivism reduction is these highly individualized case plans that the judge talked about just a minute ago. And then those are managed collaboratively between state and local stakeholders. So LAPRISTA's work includes bringing Louisiana communities together to solve these enormous, complex issues. But we're using the collective impact model, if you're familiar with that. And we're also using other evidence-based frameworks. And these are designed to bring lasting change through community capacity building. That's what Social Works does. We bring community capacity building. So Social Works Institute has 5 focus areas, but obviously its work for the last several years has been around building community capacity to reduce mass incarceration by improving prisoner reentry. And so we're here to help you do the work that you're already being asked to do. So the Department of Public Safety and Corrections, which is the DPSC, I will call the department from here on because that's a big old mouthful. So we entered into an MOU with them, Social Works and LAPRISTA, in December to collaborate on some training that is designed to respond to your specific needs, the things you asked that would help elevate the work that you're doing in the local communities. And that will also help the people who live and work in the communities most affected by crime, imprisonment, parole, and the detrimental effects of mass incarceration, and who are involved in the work of implementing LAPRI every single day. So the purpose of the LAPRISTA Community Stakeholder Training Project is to strengthen the capacity of local LAPRI steering teams to implement the LAPRR, which is the state regulation, and we're going to talk about that more in a little bit. And we're talking about strengthening it with fidelity and the ability to deliver effective, evidence-based prisoner reentry programs. That does not mean that you're not doing amazing things. What we're working to do is get all of the work up to the same level, all the work at the same good level of work that the good work is already being done. So we're going to talk about what that looks like later. The interconnected goals are to build comprehensive local partnerships with the state and to reduce the state's return to prison recidivism rate, which is what is stipulated in the state regulation. We call the state regulation the LAPRR for short. So the corresponding strategies are to expand service and case coordination, to improve the outcomes of former prisoners, which will help us get broader financial support to leverage and supplement state program funding. That's a really long sentence, but to summarize that, if we can pull our work together and produce it at a standardized level, and we can talk about what we need in order to get there and sustain that, we can attract funding from other sources. Some of you know my background is in working for a large family foundation. And so I'm bringing that knowledge and ability and skills that I have around putting together strategic funding initiatives to help bring more money to this work. Let's see if I can change the slide. There we go. Okay. So just take a look at this for a sec. I'm not going to read it to you. So one of the many ways that LAPRISTA is fulfilling its mission is to ask people on the ground who are managing the local LAPRI steering teams, and that's community coordinators, that's the co-chairs of the steering teams, and those folks who are providing services to formerly incarcerated people, what they need in terms of information and training. These people, you guys, make up LAPRISTA's constituencies, and you have successfully advocated for change in the way the state prison system operates. And now that it's happening, you're asking for more support, more information, more skills and resources to do that work. So the department is making remarkable progress in implementing prisoner reentry reforms. They began that process several years ago with the support of subject matter experts. The department's prisoner reentry regulation was signed in July 2019. It's an enormous advance of the work. It codifies the approaches that the state and its community partners are going to take together to reduce returns to prison. One way is by reducing the violations of supervision and new crimes committed by parolees. Now, this policy, like the LAPRISTA framework or the model that it codifies, is evidence-based. And that means the work is based on proven research that promotes reentry success. So we have great tools to use to help us harmonize our efforts around a standardized body of practice. So as part of the MOU with the department, we conducted interviews about the status of the implementation efforts and where you guys wanted help. And we're going to talk about those findings. We're fortunate to have a variety of funders who've invested in this work, and we want to thank them for their support, especially the many individuals who provided small donations that really add up. And you can learn more about LAPRISTA's funders by Googling their websites. Again, this is a whole lot of information. I'm not going to read it to you, but this is an excerpt from the actual policy, and the policy is in your packet. Since 2015, LAPRISTA has championed a national model for prison reentry reform developed by the National Institute of Corrections, and it's called the Transition from Prison to Community Model. And it was improved upon by the Michigan Council on Crime and Delinquency. This model is called the Strategic Planning for Prison Reentry Framework, or the SPPR. So Social Works has helped lead the effort to adapt the SPPR under the Louisiana Prisoner Reentry Initiative, which we'll call LAPRISTA, which has been endorsed by the Louisiana Commission on Law Enforcement, the Louisiana Legislature, under the Justice Reinvestment Initiative, the Justice Policy Advocacy Groups Smart on Crime and Right on Crime, and each of your 13 communities, which contributes 70% of all prisoners to the crowded system. A crowded system so crowded, over half of them are housed in local jails. In 2019, the department codified their reentry reforms in the Louisiana Prisoner Reentry Regulation, and that regulation number, not that you need to remember it, is B813. It always reminds me of that song, Please Don't Play B17 on the jukebox. I don't know if anybody's old enough to remember that song, but B813 is not B17 on the jukebox, but that's how I remember it. So this policy represents the most comprehensive set of reforms in the state's history. LAPRISTA commends the department on behalf of Louisiana and national justice advocates and reform stakeholders for undertaking this important work to meet community needs and help build local steering teams and support their capacity to implement the LAPRR. LAPRISTA is deeply grateful for the emerging spirit of commitment to harmonious collaboration by the department. The LAPRISTA Community Stakeholder Project is an endorsed training plan by the department for community stakeholders that will help operationalize the LAPRR. This training plan is the first step in our longer-term goal to deliver specific, detailed procedures for community-level implementation of this policy and to standardize practice as much as we can in order to achieve the best possible outcomes. So the link on the slide will take you to the website, but you also have a copy in your packet. So this is a little bit about the training. The training modules are based on the findings from the interviews. And so we identified 4 opportunities for improvement: reentry implementation status by location, stakeholder roles, team functioning, and effective implementation practices. This training is designed to address those challenges and the realities of comprehensive reentry service delivery, while also promoting a common base of shared knowledge and understanding to facilitate cooperation and coordination within and between jurisdictions. So we've been working with the Center for Effective Public Policy, and they worked with the Bureau of Justice Assistance and provided training and technical assistance to a number of prisoner reentry grantees back in 2008 to 2010. The center is a nonprofit criminal justice consulting organization that's been around since the 1980s, and they've been providing training and TA to the criminal justice field on a ton of topics, including transition and reentry. And they've administered a number of national projects of this kind. So as part of its work for the BJA, it created these 11 coaching packets in 3 series, and they each provide an overview of a specific topic related to reentry. And as we unfold this, we'll see how these coaching packets address so many of these issues. But LAPRISTA is very proud to have CEPP as a development partner in this project. So this is an overview of the modules that we've pulled together to provide to you, and those will be rolled out in phases. This first series of trainings takes from the 2 from series 1 and the 3 from series 2. So today we're covering series 2, module number 1, a framework for prison reentry. And while the Department of Public Safety has provided plenty of opportunities for the exchange of information and specific assistance, we are responding to just additional requests for support that we feel like we can add to the conversation. And these are specifically designed to meet the challenges in your communities regarding service design, acquisition, and delivery. Some of you know that I served briefly as a community coordinator in Jefferson Parish and helped to stand up a coalition and steering teams in that area. And Social Works was very involved in partnering with United Way of Southeast Louisiana in supporting the reentry reform efforts in that area. And so I've actually sat where you are. I've actually sat in front of a room filled with people trying to figure out, how can I get these people to show up to my meetings, and how can I get them excited as I am about what we're trying to do here? And then how can they feel comfortable knowing what's expected of them and how to weave what we're asking them to do into their busy lives with all the other things that they have to do? And so I just want to honor that this is a sacred challenge that you have before you as a community coordinator. It is a big lift. And we're here to help you and support you and lift you up in this vital role that you have in mobilizing and galvanizing and getting the community excited about what we're trying to do. And so I am not going to restate all the statistics in here, but you guys asked for some help, and we put together what we think best suited what you asked for. Part of why you're here today is so that you can receive this information and give us feedback about how well did it meet the needs that you expressed during those interviews. If you weren't in the interviews, how well does it meet your needs to carry out your job? Now, this body of work is the kitchen sink. This is what I was thinking of this morning when I was preparing for this. This is the kitchen sink. We are giving you the kitchen sink. But what we want you to help us do is figure out what things and what utensils in the kitchen sink are going to help you do your job, and then what utensils in the kitchen sink are best suited for other folks in your community who are doing maybe a little different job. But you're the experts. You know your communities. You know the people sitting at those tables every week. And we want you to help us transform the tools that we deliver to help really meet the needs of the people that you're supporting and convening. So that was a whole lot. I just want to open it up and say, does anybody have any questions so far? Oh, okay, awesome. We got a lot to get through. So This series 2 is particularly focused on improving local planning and coordination. It's all about the work that you're already doing and doing so well. Your work is awesome. It's organic and intuitive. Our goal is to join forces with you and bring and add new and fresh information and training to all the steering team tables in order to move toward more consistency and fill in whatever gaps you may have in your jurisdictions. They're going to be different around the state. And so we hope that providing this training to the 10 steering teams in the 10 different locations, we can develop, now this is the goal, consistent, high fidelity standards of practice to guide the work that will strengthen the steering team's capacity to coordinate their efforts. And I say it that slow because it's a really long sentence with a lot in it. But I want you to, it's a big lift what we're doing here. So I want you to understand, it's a lot, it's very complex. And so we're all gonna work together and we're all gonna get there. So we are providing a repository of standardized institutional knowledge. It represents those elements of a collective impact initiative, a shared vision, a common agenda, mutually reinforcing activities, data sharing, and ongoing communication. And so building that infrastructure is what is going to harmonize and standardize the work of all these 10 jurisdictions throughout the state. The repository of knowledge that we're capturing through these trainings will also help protect against the erosion of attrition over time of steering team members, as well as departmental staff and contractors. So we hope this training will improve ongoing communications and empower all the steering teams to achieve the best possible implementation fidelity. And that's what science tells us is going to lead to the best possible outcomes for our returning citizens and our communities. And an element of this that is important to point out is for the state recidivism rate to go down, all the jurisdictions need to do the work with the same level of fidelity, because if you have a high performing parish in one area and another parish that may be struggling with some aspects that's not quite there, they're going to offset each other and the state recidivism rate will stay the same. So we have to get all the boats rowing in the same direction for the state recidivism level to go down. And that's what we're working to coordinate to make happen. So we all have more work than we can do. That is no surprise to you. We hope this training will help you by providing the big picture, as well as the skills that will contribute to your work in your community. It's important to remember that while you're working in your jurisdiction, that with your clients to reduce recidivism, by helping each of them to avoid parole violations and returns to prison, you're simultaneously part of a larger goal of reducing that statewide recidivism. So today's session focuses on a Series 2 training module. The CEPP coaching packet is the primary source of the material presented today. It was originally developed to assist grant teams that were established to manage local prisoner reentry initiatives. The teams were made up of representatives from institutional and community corrections, as well as faith-based and community organizations involved in the delivery of pre- and post-release services to individuals transitioning from prison to the community. It has a much broader application, the coaching packet does, because it can be used to assess the status of your efforts in implementing evidence-based practices and effective reentry services to the formerly incarcerated. The coaching packet is also useful for mid-level managers who have the authority and responsibility to influence those above and below them, or to assume responsibility for policy changes themselves. So the current efforts of the department and its collaboration with the community under the 3-phase model represents an unprecedented amount of collaboration across complex systems and diverse institutions. These changes often require a realignment of policy and practice around an organizational and operational philosophy that promotes the success of individuals while making strategic use of limited resources. I'm sure you are all familiar with the limited resources. So the LAPRISTA and the policy, the regulation, are designed to accomplish this. This training is intended to focus on improving that local planning and coordination. Ideally, it'll continue to expand that existing foundation. And this training can help the partners in this effort build the processes that you need to clarify and refine the roles and responsibilities across organizations in your jurisdiction. And that is what is necessary to accomplish this Herculean shift in philosophy and practice over time, with the end goal of sustainably reducing recidivism and the prison population by improving reentry success. So here's our outline for today. Go ahead and take out your coaching packet or open it up on your digital screen. I took the liberty of bookmarking most of the headings in there. So you'll need to open up the bookmark panel, and that will allow you to click through to the different sections of your packet. Now, the coaching packet is a really useful tool. It's fairly brief, and you can review it, you can send it to others, you can recommend it to others as sort of a brief of what we do and why we do it. This is our agenda today, which is taken from the coaching packet. The second and third items today will be used by you when you return to your communities. These tools define the areas of need and drive taking action to address them. So each of these takes this body of the work and breaks it down to some checklists that may help you identify some activities to take your local steering teams through. And we're working with the department to schedule follow-up sessions with the community stakeholders to share and respond to these checklists and action plans that are included in these coaching packets. So why does this matter? I can give you all of these links if you'd like to use these. These are great for writing grants. And some of this is some of the most recent Louisiana state profile data, although if you attended the IST meeting this week, you heard that there is some really fresh data from 2020 coming out that was really exciting. So the Prison Policy Org keeps kind of a running overview of the states, and that is a great place to get current data. So prisonpolicy.org, and you can look for the Louisiana profile, and they will usually keep that data updated. And they track the incarceration trends in Louisiana on things like racial disparity. And so I have a lot of resources for that. If you are interested in receiving those, they're in the speaker's notes, and I can send those to you very easily. So LAPRISTA is dedicated to rational planning because we think crime, victimization, racial disparity, and the detrimental effects of mass incarceration matter. Our mission is to do everything we can to address these long-standing and very vexing public policy issues. And here's the thing. More incarceration will not make us safer. I know that's not news to you guys. Increased incarceration rates have no demonstrated effect on violent crime, and in some instances may increase crime. So the prison paradox summarizes research about the relationship between incarceration rates and crime rates. They found that since 2000, the increased use of jails and prisons accounted for nearly 0% of the overall reduction in crime. 0%. Instead, they found that between 75 and 100% of the drop in crime rates since the 1990s was explained by other factors: the aging population, increased wages, increased employment, increased graduation rates, increased consumer confidence, increased law enforcement personnel, and changes in policing strategies. So incarceration is not the answer. Research shows that any crime reduction benefits from increased incarceration apply only to property crimes. Higher incarceration rates are not associated with lower crime rates. Why? Because expanding incarceration means more people convicted of nonviolent, marginal offenses, and those are like drug offenses and low-level property offenses, and infrequent offenses are imprisoned. So Vera found that the United States spent roughly $33 billion on incarceration in the year 2000 for roughly the same level of public safety it achieved in 1975 for $7.4 billion. So 5 times the spending, no increase in safety. Mass incarceration also imposes significant social, cultural, and political costs. It reduces employment opportunities. It reduces earnings. It limits economic mobility. And this is the one I really care about because of the mission of social works. It increases the chances that children of incarcerated parents will live in poverty and engage in delinquent behavior. It's that intergenerational cycle. And so social work's mission is to break the cycle of violence, abuse, and incarceration. And to do that, we have to help parents be successful and stop cycling in and out of prisons. So incarceration is not only an expensive way to achieve less public safety, but it may actually increase crime by breaking down the social and family bonds that guide individuals away from crime. It removes adults who would otherwise nurture children. It deprives communities of income. It reduces future income potential, and it engenders a deep resentment toward the legal system. Louisiana remains the most incarcerative place in the world in 2021, placing second for a short time in 2019 behind Oklahoma, but back on top again in 2021. Now, as the secretary talked about in the IST, the numbers are coming down and they're relative. So we've been making a lot of progress. It's important to make that note because the department has been doing a lot. The justice system in Louisiana, like all justice systems in the US, is racially disparate. The Vera Report Institute reports stark racial disparity in Louisiana, as shown on the slide. So studies like the Sentencing Project's Reducing Racial Disparity in the Criminal Justice System show some amount of racial disparity at every decision point of the justice system, with the end result of prison systems showing the cumulative effect of that racial disparity. Racial disparity has incredible negative consequences for persons of color and women, as these data show, but there have been improvements, some quite dramatic, as a result of the legislation passed under the Justice Reinvestment legislation. So the 2017 JRI package was passed with 4 goals in mind: focusing prison beds on the most serious incarcerated, strengthening community supervision, clearing away barriers to successful reentry, and reinvesting the savings into recidivism support, recidivism reduction, and crime victim support. So 3 of these goals, focusing prison beds, strengthening community supervision, reinvesting savings, can be measured by the Department of Public Safety and Corrections. So according to the department's public information officer, Kim Pastorek, criminal justice reforms under the Justice Reinvestment Act have led to a 32% reduction in the state's prison population from its peak in 2012, when the state incarcerated 40,583 people for a rate of 893 per 100,000 residents. That resulted in 12,890 fewer people incarcerated. So that's huge. And finally, the annual JRI reports examine the extent to which the state is continuing to achieve those 3 measurable goals, and these are available online. So research has made clear that punishment-driven approaches alone are not effective in reducing recidivism or preventing crime. To encourage successful prison reentry and prevent future crime, we have to address the reasons why they got involved in the criminal justice system to begin with. So without effective intervention, Individuals are going to leave incarceration facing those same challenges and without the tools necessary to overcome them. And on the slide, you're going to see a list of some of those barriers. And I know because of the work that you do, you are acutely personally familiar with how these barriers are affecting the people that your community is trying to support. I can provide you with the slides, and there are a whole lot of statistics that will help you understand that. Okay, so we are going to skip through a little bit, but I want you to see this slide because it talks about sort of the way that the material is going to be organized in each of the trainings that are based on the coaching packets. We're going to talk about leadership and organizational change. We're going to talk about collaboration. We're going to talk about a rational planning process, and we're going to talk about effective case management practices. Those are sort of the 4 hallmarks of the holistic strategic framework that are how we're going to talk about lifting up and standardizing how we're doing the work in our local communities. And so, which is my filler word, while I'm waiting for my prompter to catch up with me. Strong leadership is critical to achieving significant change in reentry. And I just want to remind you that your communities need your leadership. Leaders have to agree that successful reentry is a primary goal. I don't think we have a challenge there. They also have to be willing to examine every aspect of the current system, initial assessment and case management, and having that conducted upon entrance into the institutions, the transition of offenders from institutions to the community, and post-release supervision and management practices. And that's to determine whether the current policies and practices reflect the philosophy of client success. So achieving such large-scale change is not an easy or quick process. We may have to revisit or revise things we've been doing the same for a long time. We may have to look at our priorities. We may have to re-examine how we manage relationships and how we align those relationships to support a new philosophy and vision. Leaders have to work collaboratively. Let's say that again. Leaders have to work collaboratively with others in order to develop and implement an action plan for change. And collaboration is not networking. It's not cooperation. It's collaboration. It is a deeply connected and mutually beneficial relationship where each side gives up some power, some control, some credit in order to achieve what each of those entities cannot achieve on their own. And we're going to talk in a later session about the importance of collaboration. Perhaps most importantly, leaders have to have a vision for a new approach to the work and inspire enthusiasm and commitment from others to align with and work toward that vision. So in some ways, your role in the community is the vision bearer for all of this change. You, along with your community co-chair, with your RPM, you're the vision bearers and asking your community to come along with you into this new paradigm, as the judge referred to, of doing this work in a different way so we can achieve better outcomes. So the vision of the LAPRI and the mission of the LAPRI are here. The vision is that every person released from prison back to the community will have access to the tools they need to be successful and reintegrate back into the community. The mission is to enhance public safety by implementing a seamless plan of services. So that's what you guys are coordinating. And supervision developed with each released person, delivered through state and local collaboration from the time of their incarceration through their transition, reintegration, and aftercare in the community. So that is a lot of coordination. This vision and mission were created in 2014 by the Department of Public Safety and informed by several successful reentry efforts in several states. This is your beginning point For the LAPRISTA framework, which we're going to talk about today, this is also the topic of training module 2.2, which is a rational planning process. So does anybody have any questions about this so far? Is everybody awake? Everybody with me? I want everybody to give me jazz hands to prove to me that you're with me this morning.
Yes,
Everybody give me jazz hands
you.
this morning. Okay. I appreciate it. I know it's heavy. I know it's dense. It's a lot. And we are going to skim through some of this. So these are qualities of effective leaders. This is a slide that you can use and refer back to help you think about leaders who may not necessarily wear titles of leaders, right? So these are qualities of people that may exist in your community who can help you with leadership, but may not necessarily carry that title. Sometimes we call those community gatekeepers, or you may have service providers who exercise a level of influence, and people are drawn to their charisma and their energy. Your community co-chairs are absolutely these kind of people who are connected deeply to the community and who are working to help galvanize the community by lending their charisma, their leadership, and their commitment to the work to help you lead in the community. So I would argue that each and every one of you are important, vital leaders in the community who have or can gain the power to bring people together around this difficult, challenging work that we have in front of us. So this is for your reference, but here's the kicker. Leadership alone will not guarantee success. We have to coordinate around a strategic approach. So the strategic approach gives us a way to achieve that organizational change that is necessary to overcome possible resistance and to foster commitment from the people who are helping us carry out this work. So we can consider some of these strategies when we're preparing teams, when we're inviting partners, and when we're working with others within the jurisdiction to adopt this vision we have for improved public safety through successful reentry. So recognize that change does not happen overnight. We've seen leadership establish and change priorities with regard to organizational goals, sometimes in response to events of the moment. It's not unusual for some partners to become resistant to change. They develop their own values, norms, and beliefs under the umbrella of this work. For these reasons, change can be slow. So leaders have to recognize that turning the tide is going to take consistent, continuous effort over possibly much time. I think the trajectory of some of these initiatives is sometimes 10 years to get to the recidivism reduction goal. And I think we're maybe 3 or 4, maybe 5 years in. The other thing, recognize your system's culture. You guys are the expert on that. You're working with all the different levels and all the different folks and all the different constituencies in your community. So you see from a very important and unique standpoint, the culture that you're working within, and your understanding of that is going to prepare you to support your RPMs, your community co-chairs, and your other co-chairs to lead this work and tailor their message and their leadership efforts to the culture of the community that you are working with on a day-to-day basis. And so you're going to need to incorporate that understanding of a culture by listening to others, by collecting information like using surveys, focus groups, or meetings, by gathering information on the behaviors, norms, and attitudes of the present system so we can understand the starting place for change and build from there. You can examine your current, with support from your co-chairs and your steering team, examine your current policies and practices. We and our teams need to review all the existing policies and practices. We need to think about what message is this sending to the professionals that are coming to the table to help us, and what message is it sending to the incarcerated, formerly incarcerated people that we are trying to support? Do these policies support prison reentry as a critical concern in the community? Or do they encourage activities and behavior that add to the barriers to client success? We need to review the research and share it with others. We should become familiar with the empirical research on prison reentry. We need to be familiar with the relevant data to our jurisdictions. And fortunately, the department has broken that data down by the jurisdictions. But we're looking for reentry barriers. We're looking for recidivism rates to ensure that we develop goals and plans that are both grounded in what works, but also what is appropriate for your jurisdiction, right? You are the knowledge holder for that with your steering team. So we need to create opportunities to share that information with others so they can be included as part of the discussion on identifying the targets for improvement and helping us design the process to get that work done. And we also promoting your new vision. So to promote buy-in, we need to consistently message about the new vision, why it's important, and help people understand the role that they will play in helping bring that new vision into reality. Leaders and teams working to achieve successful reentry change have to communicate that path to all those who influence and all those who are affected by it. This can be accomplished through a variety of means, including internal and external publications, presentations, and public speaking opportunities. So I'd like to open it up for a few minutes for just a very brief discussion. So does anybody want to talk about any examples of maybe resistance that you've experienced in your local jurisdiction and how you were able to overcome it? Did you use one of the tools that were on the slide? And I'll circle back to that. So let's go back. Does anybody have anything they want to share? Any challenges, general challenges? You don't have to call names or anything. You can just talk about how you were able to bring someone in your local jurisdiction around this new way of doing work that might have been a little bit resistant. So everything is going smoothly. That's amazing. That's awesome.
You're doing great.
I know you guys are. I know you're doing great. Thank you, Tatiana. Go ahead, Sharita.
Good morning, everybody. So yeah, Bonnie, to your point about a specific challenge, I think most people know that in Baton Rouge, we already had an existing coalition when we were trying to build up kind of the work that we were doing around LAPRISTA. And one of the things that we had to spend a lot of time on is promoting a new vision, and then making sure that people kind of acknowledge the existing culture in the space, and bridging those two together. And so a lot of times when you are trying to do something new that is not really new, people might misunderstand it as a threat. And so being able to just constantly share with those people that were already involved in reducing recidivism and reentry work, constantly sharing with them what we were trying to do, but also sharing how it overlapped kind of with their existing culture and how it enhanced their existing culture was a big help. And to the point about it doesn't happen overnight. I think I'm the community coordinator now for, this is year 3 or something to that effect. And we are still in some ways challenged by those differing views. And so we've made a lot of progress, but it certainly is not where anybody may hope that it would have been 3 years later. And so there's also that being able to kind of maintain people's interest in something that takes longer than they think it should.
Thank you for that, Sharita. I appreciate that so much. And I always like to say you win or you learn. There are no losses, because everything that happens teaches us something that we can use to improve how we do things. And so I always say, let's reframe challenges as opportunities, because those are opportunities to learn and grow and compare and take information about different scenarios and confounding variables and use those to help us improve and strengthen the system as a whole. Anybody else? Okay, thank you so much.
I can't speak for everyone else, but I can say for me, I'm Sherry. I'm in Turbo and LaFouche. I'm the community coordinator.
Hi,
I
Sherry.
am new to the program, so I am just learning. So I just started in August, so I haven't really gotten to the area of challenges yet. So I can't speak for everyone else. So this is my part where I'm learning. We were hit very heavily by the Hurricane Ida. So we are still in the phase of our community where, not that ReEntry is not formal on the people who work it, but for the people who you want to bring along, those community partners, that's not their focus right now, because their focus is still on rebuilding their homes, rebuilding their businesses, rebuilding the community. So it's not an area of concern, but it's an area of acknowledging where people are at and being okay with the understanding that, and knowing that it may not happen this year, but you can start planning for the beginning of next year. So that's where I'm at in my journey as the community coordinator, because I'm new to it, but I'm aware, and I have to acknowledge that you can't start something new or introduce something to people when they're still in survival mode.
Right, and I think that is a beautiful example of recognizing your system's culture and being sensitive to where they actually are. I think if you busted up in there and said, hey, I know y'all are busy putting things back together after the hurricane, but we got some deadlines here we need to get pulled together, that would really work against your long-term efforts to pull them around a shared vision. So what beautiful wisdom that you have there, Sherry, and thanks for sharing that example with us. So I'm going to move on, because it's taken a little bit longer to speak this out loud than we anticipated. How's everybody doing? Anybody want to give me some jazz hands? Wake up, take a deep breath with me. 1, 2, 3, take a deep breath in and breathe it out. Whew. All rock stars have to breathe deep, so just make it a part of your regular protocol. All right, we're going to move along. We have some other questions in here, and we have covered all of those. So these are some tips for leaders. And so I think that as skilled facilitators and conveners in your community, you are probably very likely with most of these, but here's some to check against, refer back to. If you're having a particular struggle in your community, maybe this will give you something that you haven't quite thought of, or something out of the box. But these are things that are absolutely critical to mobilizing a large group of people around the work that we want to get done. Okay, so we talked earlier about the important role of collaboration. It's no secret to you, but many of the complex barriers faced by the formerly incarcerated people that we're trying to help are beyond the expertise and resources of most individual corrections agencies. That includes housing issues, employment barriers, educational needs, mental health problems, financial instability, social stigma, family reunification, right? So clearly, to get all of this work done, which is what the people we're trying to help need, we have to have a well-planned and collaborative response from a diverse set of agencies and individuals. But here's the thing, collaboration doesn't just happen. Harmonious collaboration definitely does not just happen. So bringing various individuals together, and sometimes they have competing interests, which they are entirely entitled to have, but bringing them together to develop common goals and clear responsibilities for the prison reentry process can be difficult and time-consuming, and sometimes frustrating. But we have to remember, all these diverse experiences, all these different perspectives, and the resources that they have contribute to overcoming the challenges of improving the reentry process. So we cannot get it done unless we work well together as a tapestry of collaborative effort. So in creating partnerships, these are some of the values that can pull people together. And so we're not going to talk about it here, but as you're thinking about follow-up to this session, this might be a slide that you refer back to and ask yourself, to what degree does this describe your current steering team in your local area and your coalition? Who's missing from this list, which this list is quite general, and we're going to get to a more specific list, but this is a way to think about what other partnerships may we need, even outside what's defined by the documents that are tied to this. And so what might be in here is, what's not in this list necessarily is persons with lived experience. What about faith-based? And faith-based should be included specifically. What about individuals who have a vested interest in community safety, like law enforcement, defense attorneys, prosecutors? So this is your local steering team membership list as it currently exists as a part of the policy, the LAPRR. Now, this list has been revised from earlier iterations of the local organizational structure. Some information was removed from that LAPRISTA has requested to be added back, and those policies are under review by the department. But this list is relevant because it technically represents the roster of the steering team. So if the coordinator's job is to ensure that the roster of the steering team is fully completed, then this list represents when that list is done, when all the representative seats from these stakeholders have been filled. Does anybody have any questions about that? Has everybody seen the local organizational structure that has all of the seats that the policy recommends that you have in your local team? It's in your packet if not, and it is called the local organizational structure.
Yes, and Terrebonne and Lafourche was built based off of this steering model. So we're one of the very few in the region who was built off of the model, the way in which it was designed.
Awesome, thank you, Sherry. So I want to take a second and ask, how do you recruit members to your steering team? If you've got a seat that's in this list and you're not filling that, and that seat needs to be filled, how do you get that seat filled?
Outreach opportunities, just making sure, making sure that you can engage in that area of expertise, all of the stakeholders from that region, and invite them in for a conversation. What I did is I set up appointments 30 minutes with each of them. Just a simple, hey, I would like to see how we might be able to collaborate and measure the level of expertise and commitment, and to see if they like second chances or even a re-entry field of work, and if they were able to expand those services towards our community and population. So that's just one of the things that we can and cannot do. And we set up Zoom and in-person, walk through the facility and invite them into the conversation.
Perfect. Does anybody have any experiences with reaching out and engaging a formerly incarcerated person to serve on your steering team or your coalition? And maybe an experience of how you reached that person and how you were engaging them around showing up for the meetings.
In St. Tammany, there is a peer support specialist, and how I kind of came in contact with him, he was already working as a peer support specialist for Volunteers of America, but I actually went to our local jail and I was meeting with with some people up there. And as I was walking out, I noticed that he was meeting with some families, and I just kind of asked, you know, who he was associated with, what his work was like. We just kind of got to talking, and he was more than happy to come on board.
Beautiful. Brittany, does he get paid to do that work?
For Volunteers of America, he does.
Okay, perfect. And so thanks so much, Brittany. So, and one of the things that we've recognized as a challenge from some of our formerly incarcerated organizations is that most of our meetings are held during regular business hours, which makes it really difficult for a working formerly incarcerated person necessarily to attend. And so, you know, we need to think about what are the ways that we can help formerly incarcerated individuals overcome some of those barriers to participating in our community planning process. Thank you so much. So we're going to talk about a couple of levels of collaboration. So policy level collaboration. At that level, individuals on collaborative teams may come to the table with different missions and visions, which may not initially complement each other. It's still important that everyone involved contributes to the development of a shared vision so all the team members can support and work toward that shared vision. Team members have to find a way to reconcile all of those goals and missions of all the differing agencies that they represent with a shared system-wide vision for prison reentry. It starts with identifying common values and desired outcomes. So most team members can agree that the success of formerly incarcerated individuals leads to greater public safety, reduced crime, fewer victims, and an improvement in the quality of life in the community. And so those are some values that you can say, hey, if you're interested in those things, just as Tatiana said, what are you interested in? Or if you're interested in these things, we have a place for you to come and help create those conditions in our community. Policy level collaborative teams should include those with the authority to make policy and resource allocations for their agency and for their organization. Policy teams operate most effectively when there are equal levels of authority among those at the table. So the slide shows some common undertakings for policy level teams focused on prison reentry issues. Bear with me a moment. Thank you. So many jurisdictions have successfully implemented collaborative efforts at the policy level using a tiered system of collaboration. So in Louisiana, the Tier 1 policy team is generally the Tier 1 policy team, let me see. Policy team is a decision-making body authorized to review and set policy for the state on reentry issues. Such a policy team is often established by the governor and includes state level, cabinet level executives also appointed by the governor. And they typically represent housing, labor, health, welfare, education, economic development, among others. Sometimes they have community and faith-based leaders, and they should be invited to participate. The Tier 2 is typically made up of policy level staff from multiple agencies and organizations, and they're charged with implementing the decisions of the Tier 1 policy team. So the Tier 2 team first studies the decisions of the Tier 1 team to determine the best methods for implementing those decisions, and then is responsible for providing oversight to the implementation of those policy decisions. And that's your keyword to help you figure out which is the Tier 2 policy level body in Louisiana. Together, these policy teams create an infrastructure for collaboration by developing policies, removing organizational barriers that inhibit collaboration, and making decisions that complement the larger reentry effort. And they also can be focusing on procedures to implement the policies, resource allocation, creating and monitoring specific implementation expectations, and determining performance expectations, and then monitoring and reporting on those results. This is in your coaching packet on page 14. So I kind of gave you the answer to this question, but does the state level organizational structure of LAPRI satisfy the two-tiered system recommended in the CEPP coaching packet? Yes, it does. Okay, great. And I'm sure you've been participating in the IST and RAC meetings. How have you seen prison reentry policy affected by these bodies? How are they working to make those changes? Anybody have any examples?
On the advocacy level, Bonnie, is that what we're talking, correct? And the way of advocating for the law and regulations that will actually remove some of those barriers for our second chances.
Absolutely.
We have seen that with the Clean Slate campaign, right? The expungement clinics. And how can that be detrimental just for employment seekers, which it will in turn perpetuate that negative cycle within the barriers for our reintegration process, which ultimately that's what we all want.
Absolutely. Very well said, Tatiana. Thank you so much. That was very nicely done. At the IST meeting this week, the JRI report was discussed. It was talked about, I think the prison population went from somewhere, or readmissions went from 14,000 to 9,000 and some change. That is huge. And that's obviously an indicator of how the system is impacting the work, right? The vision. So I have an example. One of them is, I heard Secretary say several meetings ago, this is a new day in probation and parole. We are here, probation and parole officers are to help, to work with the community to help avoid technical revocations. And I saw that CSG came out with a data point. I'm not sure what the years of the data is, but they came out with a data point that new readmissions due to technical violations were down by 38%. That's significant. I mean, that's more than a third. And so when you have a vision held by the leaders in the system, and that is shared in these convenings that we have, and then it trickles out as practice into these local steering teams, that's when we get those metrics. That's when we get that performance of the system working. So very good, very good. So how many of you have heard of the three-phase model? Okay. So collaboration at the case management level contributes to individual client success. In practice, we're working to create a seamless approach. I've been calling it, since I came to the work, a seamless continuum of care, because I really like how the healthcare model of continuum of care and coordinating the care of people leaving the hospital to avoid hospital readmissions is a very fitting metaphor for what we're also trying to do. So in practice, a seamless approach at the case management level requires collaboration across all phases of the reentry process. So institutional, getting ready to go home, and while they're in the community. And that's huge. Those three areas prior to the three-phase model operated in complete silos. And as a matter of fact, no information went between that. And if you add in the court where sentencing happens, the horror story I heard way at the beginning of the work was that the judges had one body of data in a file folder, then the institutions opened up a new file folder. When that person got transferred to probation and parole, they opened up a new file folder. So that information was not being shared amongst all of those agencies. But the department has made tremendous efforts, Herculean efforts in working within a giant institutional setting to create a pathway for this individual case information to move with the client, with the individual, through the system, through the three-phase model, to make this seamless continuum of care possible. So we give the department a big hand because they have made the investment, one of the core investments, to make that seamless continuum of care possible. So I know you guys are familiar with this. The institutional phase, we're gathering risk and needs information, and we're providing activities during custody that are designed to aid release. In the transition phase, we are working with the collaborative case supervision and management team. Prison, parole, and community members begin to prepare those transition plans. And then in a community phase, we're looking at what do they need post-release. The CCSM team, parole, and community members finish those transition plans and provide accountability and support. In the transition phase, as Judge talked about, approximately 6 to 12 months prior to anticipated release, the collaborative case management team reorganizes to include individuals who work both in the institution and those in the community. So that's the handoff team. I think in Jefferson, we call that the transition team. And so that we are getting those folks ready and prepared for release. And during that period, concrete plans are developed, including housing, employment, family reunification, legal services, education, and behavioral health. Those are the 6 priority areas that we're looking at to make sure that we have a minimum amount of services prepared for those individuals. Now, these first 2 phases of reentry are so difficult in Louisiana for a variety of reasons. So many sentences are 12 months or less, okay? That makes the prison part and the pre-release part really, really difficult, but especially those activities centered on reentry. So the department wants you to know, they want you to understand the scope and impact of this situation as it affects the needs of the individuals released under those conditions. So we're talking about people who have less than a year to serve. We're working with the Department of Public Safety to obtain and share that data so we can explain it better to you to assist you and your steering teams and coalitions in service planning and coordination. And then last but not least, we have the community phase. So the collaborative case management team, once again, is reconstituted to include those individuals who are providing accountability and support to the formerly incarcerated individuals in the community. That can be parole and probation officers, community-based treatment providers, community support networks, and others. So collaborative teams are working to improve the transition of incarcerated persons from institutions to the community, and they should consider both multiple policymakers and stakeholders involved with the client at the case level. Who needs to be in that plan for this person? What do they need? Professionals at both levels have an enormous impact on the way the present system operates and have a role to play in improving prison reentry through the collaborative policymaking and the case management processes. So it's important, the policy folks need to be involved as well, so they're fine-tuning the other elements of that community and institutional response. So you've kind of got the case management level here, and you need folks there who are looking at the case management relevant issues, but you also want policymakers involved in that process. So here is hopefully a slide that is relatively familiar to you. We're going to cover this slide and then we're going to take a break. So the reentry accountability planning process, this is in your packets. Please look in your packet. So this is the 3-phase system, and it talks about the 7 decision points in this system. So does the LAPRR reentry accountability planning process satisfy what we just talked about? The policy level and case management level collaboration. Thank you, Judge. I know you just talked about that this week. So this is a great tool for you because this is the ideal. This is the goal. This is the process that you are helping to create on many levels. And so it can provide you with an opportunity to find where in the process can we fine tune what we're doing, who's coming to the table, how we're engaging them. Okay? And so as you're doing this work, you're thinking about what are the assets, barriers, and gaps in implementing this model and implementing this process in your local jurisdiction. Okay. Does anybody have any questions about this?
I don't have any questions. I have an observation.
Okay, go ahead.
So many of the folks that we are releasing are obviously being released on parole as opposed to probation. And the reality is the folks who are being released on probation, the judges are involved in that supervision, and they have a lot more capacity to get involved to encourage the probationer to get back on the right track when they're involved. And the reality is that is not the same for our parolees. So we need to communicate with the parolees why it's in their best interest, how their lives will be significantly improved if they will actively work this reentry accountability plan that they help develop and consume those services in the community. We really have to have them engaged, and it's their plan, their program, and we're just helping them to execute their program.
Right, that is a really big part of this process. If you're thinking about motivational interviewing, getting their buy-in and their consensus and helping them work with the community providers that are going to provide them services to create this plan, it becomes a partnership in their success rather than a list of activities on a list of paper, on a piece of paper with no accountability. And so can anybody talk about your process for when you do InReach? How do you engage the individual to get buy-in into their plan? And how are you incorporating community providers to contribute and connect with that individual? And I understand that COVID has made all of that a real challenge if it's happening at all. But let's just talk about maybe what you have in your mind as the procedure, or maybe you even have a written protocol that you've got, even if you haven't been able to implement it. But what are you doing to connect that individual with their service providers around that individualized plan, if anybody wants to kind of share their process?
Bonnie, this is Pat Williams. I'm the Exit 318 Reentry Program Manager here in Caddo and Bossier parishes. I manage 2 of the CIG grants. So I can talk to you from my grant perspective, how we engage our participants. Our referrals do come from DOC and other state facilities. Pre-COVID, we went in and visited with those who chose to enter our program. They had InReach up to 90 days prior to release. They developed those relationships with their housing case manager, their case manager for Medicaid, SNAP benefits, healthcare, substance abuse counseling, and then with their job placement. Post-COVID, all of that changed because we could not go in, but our facilities that we work with, which were all over the state, David Wade, Hunts, LCIW, Caddo Correctional Center. We've done Zoom meetings, we've done phone conferences. The relationship does suffer because we can't go in, but we have found it very successful to develop those relationships prior to release.
Does the individual actually connect with a representative of the service provider at any point?
Yes, so pre-release, yes, and then most definitely once they're released, They have weekly meetings with their case managers. We have weekly meetings with our team, which includes about 10 different people. Parole is heavily involved with this. There are 2 case managers from Easter Seals. There's 2 from Volunteers of America, 2 from Goodwill, and then other community partners. We have community partners with substance abuse and mental health, inpatient and outpatient. So it's a really holistic. We accept any offense. We're not biased against sex offenders, violent offenders. We provide legal services through Acadiana Legal Services. It's really a holistic approach.
That's awesome. Thank you, Pat. And thanks for being here today.
And well, I appreciate you allowing me to attend.
Well, you've got that lived experience that we need to help us as we're harmonizing all of these efforts together.
Right. I'd also like to mention that I also had the lived experience, not only just working in reentry for the last 6 years and understanding what LAPRIA is about, but also I have the incarcerated lived experience.
Thank you for sharing that. And we're so honored and so grateful to have that important perspective to help us get this work right. So thank you for that.
Thank you.
Anybody else?
In Terrebonne and Lafourche Parish, we start this process while they are incarcerated. So what we have our reentry team that is stationed in the Lafourche Parish correctional complex that they will go to them up to 5 years before they're released. And so they start programs while they are incarcerated. So they're case managed and they are assessed while they're incarcerated. So their needs. So there's a assessment that is done. And so it is released to us at Goodwill and released to all the community partners what each individual client is need. I have the extra added bonus that the case manager of Lafourche Parish Correctional Center happens to be my twin. So when when our clientele transitions from being incarcerated to being in the community, they see a familiar face, even though it may not be the same person. They do see a familiar face.
Now that is a very unique benefit to your contributions to this work. That is awesome. Please continue. Yes. I'm sorry.
That's fine. Tatiana, and I do have an identical twin. So, and she works actually inside. I work in the community and outside externally. So it works kind of hand in hand. So she assesses everyone. The team, they assess everyone there and they allow us to know what they need. Plus we also hold every third Wednesday of the month, the steering team gets together and we actually discuss the cases and the individuals and the concerns of which will be need for the collective and how we can improve.
Perfect. And so a lot of this comes back to knowing your culture and designing that process to fit the culture, fit the institution. When I was in Jefferson, we worked with Plaquemines Parish Detention Center. It was like 2.5 hours away. You're just going to have different challenges, but you guys are the architects. You guys are the technical consultants to design that process to meet the needs of all the myriad of agencies and organizations and individuals that we're all bringing together around this. So whoop whoop to all of you, because y'all are rocking it. Welcoming you back, y'all. Come on back and join us. We're making good progress. I think we're going to get through to the end of it. Bear with me and let me get this slide deck pulled back up. There we go. Oh, I see. Okay. Everybody back? Everybody here? Everybody with me? So let's do some jazz hands and take a deep breath. Ready? And so we're going to breathe in for 4. We're going to breathe out for 6. We're going to do that 3 times. Ready? Breathe in. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4, 5, 6. Breathe in. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6. One more time. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4, 5, 6. And again, I just want to offer that to you. I don't know if you're like me, I get really overly excited. I get to talking fast. That is kind of like shifting into a lower gear. If I just take those 3 breaths and do that long exhale, it kind of gets me back down to where I'm not talking so fast people can't understand me. So I'd like to offer that to you. I'd also like to offer it to you if you're working with individuals who are in a state of stress, if there's some conflict in the room, if you're working with a trauma survivor. That is a way to really get their amygdala offline, get their prefrontal cortex back online, their executive functioning center, and have them to be more present with whatever it is that you're working with them to do. Maybe it's planning, what have you. So sharing that with you as an exercise to take into the world as you see fit. So welcome back. And we've had a great first hour and 15 minutes, really digging into some of these basics. Now, here's what I want to remind you. This is the kitchen sink. So a lot of this is going to be stuff that you already know, right? And a lot of it may seem really super, super basic. But what we're putting together is a video that can be used to onboard new community coordinators. And so in some ways, it needs to be a little bit basic because it may be someone coming into the work who has a patchwork understanding of what we're doing. And what we're really doing is trying to hit all the points so that the knowledge base is complete. So we're standardizing what everybody knows about the basics of what we're trying to do. So if it feels like it's like, hey, I already know this, that's totally fine. That's what we're kind of going for. And then the other piece is when you do your feedback, because you're going to get a feedback form, please let us know what was particularly useful to you. What filled a gap for you? What do you think if this is a unit of training that's being offered to someone brand new coming in, what parts of it were most useful? What part do we not need to worry about, right? So you are kind of our focus group to help us continue to massage this information to be very succinct, which is hard to do with a lot of complex information, but to also just be super, super useful for onboarding community coordinators. And then another element or layer of it is it's also going to be used in a different way and to a different level of depth with broader based community stakeholders. Okay, so I just wanted to remind that of you. I know that you guys are doing all kinds of this stuff where you are because you're brilliant, you're leading, and you're taking the initiative to respond to what your community needs. Keep in mind that the way we get to the end result is that we have everybody doing the work with the same level of fidelity. Okay. Does anybody have any questions before we get started about anything that we've covered so far? No. Awesome. Okay. Did I hear someone? Yes, Julie, go ahead.
Thanks. Julie LaFleur, Community Coordinator in Lafayette. So not a question, but I did have a comment. When you mentioned who would be vested interest in community safety. I think the first thing I thought was neighborhood organizations and people going back into the neighborhoods that they came from. And so that's one maybe part of the community that we might not think about, but I think neighborhood organizations are vitally important because, you know, people are being released and going back into those neighborhoods. So I just wanted to mention that. And also,
Go ahead. Go ahead.
well, also on another note, as far as in Lafayette, what we're doing right now is community partners are doing InReach virtually. Once a month, they're doing basically an informational session to get the offenders interested in their programs. So they are on the calendar, you know, for a specific day and time each month. And each month they get a new set, of course, you know, limited to the room space, but I think we can have like 2 rooms with 8 to 10 people in it. And just introducing the offenders to their services so that they can get them interested, you know, a couple of months out before they're being released and before they're talking about transition plans. So that's kind of what we're trying to do, is just introduce the offenders to what's available in the community, or they may have heard of the organization, but they really don't know what they do and how they can help them. So.
Awesome. Does that ultimately lead to the individual selecting? So like, let's say there's 2 or 3 housing options. The individual says, hey, I would like to be enrolled with that housing option. And that's put into their individualized case plan as part of their overall planning process?
Yes, that's the goal.
Okay, awesome, awesome. So it's a really important part. I mean, I know you guys meet regularly and network and that kind of thing, but you guys have so many great examples of how you're already intuitively, you know, stepping into these spaces and creating solutions that are in alignment with the model and are meeting the needs of the community and the individuals that we're trying to serve. I didn't say it earlier, but LAPRISTA prefers to use the term either incarcerated individuals or formerly incarcerated individuals. Although some of this older paperwork that you see has the word offender, we prefer to use what Robert has educated me is human first language. So we're not defining them by what happened in the past. We are using a little bit more progressive and humanistic language. So we use incarcerated, formerly incarcerated, judicially impacted. I forgot to say that earlier, but it was definitely in my notes. But I appreciate you, Julie, for sharing that example from Lafayette. Thank you so much. So case level collaboration is something that you guys are already doing. But again, as we talked about, you may have intuitively be doing some of these things. This is a list that you can maybe go back and see, are there any areas where I can bring something in to really rev up my case level collaboration game? Okay, so this slide is there for that. And we are going to be providing some deeper training on this. That is in foundational knowledge. It's series 1, section 2, module 2 on LAPRISTA steering team roles, responsibilities, comprehensive planning, and service coordination. So we're going to do a little bit deeper dive on this particular aspect of the work. Now, the other piece is a rational planning process. And that is just a term to really describe a plan of how we are going to coordinate such a complex and diverse system of so many actors and agencies and organizations and individuals and jurisdictions. But what we know is we're more likely to achieve reasonable, effective, and lasting change if our team can agree on some of these things, precisely where it wants to be, what it wants to achieve. where it currently is with respect to the vision that's been identified, who should be at the table. So who are the stakeholders who are going to bring the skills, expertise, and resources that are necessary to help us effectively plan for change? And what are the existing strengths in the jurisdiction or the system that we can use as a foundation for future efforts? And then a clear identification of the barriers and needs that have to be addressed in order to achieve success. And that means what barriers in the system for the individuals, but also what barriers in our structures, right? What barriers in our structures need to be addressed? And my teleprompter just jumped to page 1. Bear with me one moment. Take this opportunity to take a deep breath. While you're breathing, why don't you take a look at this process? And I want you to think about a couple of things. One of them is, if this is a rational planning process, what are the elements that you see here that you've observed at the larger level with the tier 1 or tier 2 policymaking organizations? And then where is your local jurisdiction in accomplishing some of this? And let me know, does anybody want to share about where you think you are? So if this is the ideal, where is the state in this rational planning process? And where is your local jurisdiction in this rational planning process ideal? And remember, we just talked about the fact that it's important to know not only the ideal, but where you are relative to the ideal, so that you can take action to move a few steps closer to the ideal. Anybody want to share? So we're talking two things. Where is the state, if this is the ideal, and where is your local jurisdiction? If you were just heuristically, thumbnail right off the top of your head, sketching, where are you in this list, if anybody wants to share?
I think, Bonnie, we're now, at least in Orleans Parish, because we do have a wealth of resources. We're now rural. We are engaging into different domains, employment, health services, mental health, and everything else. And like Sherry has shared, our engagement process is a little bit different. We are now developing specific objectives for each of those goals. In addition to implementing, I don't think one is exclusive without the other. I think they overlap. And a lot of times we go back to develop and prioritize new goals and then implement them accordingly, depending on the season, depending on what happened. Even Sherry just mentioned with regards to Ida, it has affected a lot of our region. So we had to redevelop and prioritize some goals and then specific objectives to each of those domains, and then monitor what is the impact or the growth impact, success impact, and what is the strategic plan that you need to develop on a daily basis. I think the key word will be flexibility.
Absolutely. And things are going to shift and require adjustments, right? So thank you for sharing that, Tatiana. So this again is another slide that can help you galvanize your community around a process, right? I just asked you, where is your community in this process? You can ask your community, where are we in this process? Where do we need to pick up the baton on this work? And the ultimate goal is that you produce a plan in writing that is driven by the assets, barriers, and gaps that you identified in your community needs assessment. My understanding is that all or most of you guys have produced a community needs assessment for your community. Now, a comprehensive community reentry plan, we call that a CCRP, is sort of like the work plan for the community. Now that we know what our community needs, we can't do all that work. We can't get all that done. but we can prioritize 1 or 2 or 3 items in each of the areas, and we can come together and form work teams to move the needle on overcoming those barriers, leveraging those assets, or writing grants or obtaining resources to fill those gaps. And that comprehensive plan is the work plan for the community. This is what person A is going to do to accomplish goal B, and they're going to do it in this timeline, okay? So the rational planning process is about creating something that reoccurs over time, and that is engaging your community in defining the action steps it's going to take to move this work along a continuum of progress over time. Does anybody have already a comprehensive community reentry plan that does that? It basically says this agency is going to work here, or we have a chair of this committee working on housing, and housing's goal is to maybe create 10 more units of sex offender housing, and they're going to do steps A, B, and C and accomplish that by middle of next year. Anything, and that's just an example. I'm just pulling something out. Anybody have anything that looks remotely like that? Okay. So here's what we want to let you know is we're here to help you do that. I don't know about y'all, but whenever I want to get a read on how I can support a community and what I need to do, I look to see if the hospital or the district attorney's office or some agency that's charged with sort of understanding the scope of the problem and taking a leadership on that issue has any kind of a comprehensive plan that says, here's our priorities for work over the next few years, and here are the agencies that are going to do the work. And in some cases, it might have it completely operationalized into goals, objectives, and tasks. And then I figure out where I can plug in to a committee, or where can I plug into a work group so that I can come and contribute to that overarching goal that this group has pulled together. So we're gonna work with you. Be thinking between now and later on, I don't know when, and I don't know what the prompt will be, but be thinking about what are the steps, or what is the support that you need to help you write a plan like this, right? That anybody can pick up and say, if I open this, I know exactly where I fit into this really big plan. If I'm a behavioral health provider, I know that these are the objectives for behavioral health, and I can implement policies in my agency that will help this jurisdiction achieve these goals for improving behavioral health response for formerly incarcerated people. Does that make sense? Yes, so it's a script for people. And what's going to happen is you now have something that a new behavioral health provider comes to the table in the meeting. They're not confused. You say, here's the plan. What part of this work would you like to do? Right? And I would say in that case, it takes the pressure off of you to be the orchestrator of everything that gets done in some degrees. And it becomes the shared vision and the way that the work gets done. So that is our ultimate goal, to help that drive an even greater coordination of activities of people who are coming and going out of a very flexible system. But we're standardizing how the work gets done, even if we're having these variations in who's at the table. Does anybody have any questions about that?
Bonnie, this is Pat. I do have a comment regarding the housing, the planning process. So my program works with high-risk, high-need offenders. So my program does provide housing for those. The gap is those first-time offenders, those sentenced less than 12 months, because they don't make it normally to the state system. They stay locally. But what we've done here in Northwest Louisiana at Goodwill is we are working with the city of Shreveport regarding housing. We've been in conversations with Bobby Collins. Nina Webster has been involved in that, along with representatives from Department of Corrections, Rhett Covington, Robert V. Hawk, Nicole George. And is there a short-term solution? No, but we do have our city officials looking at the gaps that exist. That HUD, there's not enough of the COC vouchers available for those who are coming out. But in Northwest Louisiana, we are implementing the housing process with our local officials.
Okay, that's perfect. Perfect, perfect. And so just to take that with a comprehensive plan, if a new housing provider comes in and those efforts are in writing in that plan, then they have a sense of how they can plug in to support the work, right? To either they reach out to the housing authority to get on the list, or they reach out to the community coordinator to say, hey, I've got some sober living housing and here, you know, we want to work with you. When I talked with Assistant Secretary Covington earlier this week, we talked about the fact that one of the key elements of getting this work off the ground is the resources are always going to be shorter than or less than what we need to serve the full population. So what we're always looking to do is invite providers who may already be serving this population and ask them to pivot or allocate some subset of their population. There's some subset of their services to our population, right? So we're not necessarily, we can't, and we don't have enough resources to create all the slots of services we need, but we're always looking for people who may have maybe nimble enough to take some existing slots that they have and serve our population. And that is one way that we build momentum to articulate how we're serving how we're meeting the need that we can, and what the number of slots is that represents that unmet need. So thank you for that example, Pat. So we're going to talk a little bit about the importance of being evidence-based. And I know you guys already know all this, but this is really about, again, this is a kitchen sink thing. So evidence-based practices have been proven to lower client risk by addressing needs over time. It's a key element in the rational planning process. And so when you're assessing where we are, you're going to keep an eye out for what of the things that we are doing are evidence-based and what things might be anecdotal, what things might be just things we've always done. And it doesn't mean that you're doing anything wrong. It just means that you're saying these things we know are evidence-based. These are some things that may or may not be, but we want to replace them with things that we know are evidence-based. And it's constantly a process by which we're improving and bringing more and more evidence-based practices into how we're designing and carrying out the work. All interactions with clients should be guided by the evidence-based practice. And part of the reason why is because teams are less likely to succumb to external pressures or jump around for solutions. It creates less variability in the solutions that are being delivered if we take the time to sort of identify the evidence-based practices and integrate them into the work that we're doing every day. And what's beautiful is the LAPRI and the subsequent LAPRR regulation is all based on evidence-based principles. They're embedded in that first set of decisions that were made by the department in 2014, and they are captured in what's called the DPSC System Blueprint for Reducing Recidivism. And that is a labeled attachment to the policy in your packet. So I'd like to give you a sec to look at that system blueprint. How many have seen that before? So having access to the system blueprint gives us a sense of what does the department see as the activities that need to happen for the department to achieve this reduction in recidivism. Right? So it is another tool that we can use to assess where are we in this very large complex system and how well is what we're doing locally aligning with this higher level blueprint about what the department is trying to help happen on the ground and at all these different levels in between. So evidence-based practice should not be confused with programs or curricula. It goes beyond programs and curricula. And that's addressed through the collaborative case supervision and management model and the development of local comprehensive community reentry plans, the CCRPs that I just talked about. So there is an evidence-based practice for collaborative case supervision management. And that is documented as an attachment to the policy. And so that sets the corners of how the practice can occur, how it should occur according to evidence-based practice. Then the CCRP goes on to explain how the community is going to take action to achieve these goals within the framework of evidence-based practice, which is set out in the collaborative case supervision and management tool, which is in your policy. So it goes beyond policies and curricula. It's processes, it's practices, it's building that continuum of care approach that we're going to cover later. So through your knowledge of evidence-based practices tied to a commitment to monitor and measure specific results and impacts, which the department is doing, that helps local teams determine what information to gather, how to interpret that information, and what actions to take based on those findings. So we're always in a process of where we're reading what's happening and we're using that information to tweak what we're doing and bring it. I would say it's like turning a wrench, right? We're always reading the data and we're saying, at this point in the process, we can tighten up what we're doing a little better to be more in alignment with collaborative case supervision and management model. And so also to make sound decisions when we're changing existing systems, we have to understand how current policies and practices may or may not adhere to evidence-based practice. And so we have to craft new intervention strategies based on that research. We have to take the time to ensure that everyone on the team is educated about the current research findings. That's absolutely necessary as a preliminary step in the rational planning process. So, you know, understanding all of those things, where your jurisdiction is in its implementation of evidence-based practice and collaborative case supervision and management is a really important starting point so that any action that you take is well informed from there. So does anybody have any questions about that? Because that was a lot. It's a big job. Is anybody using data right now to drive decision-making in their local jurisdictions about how they're tweaking, engaging the individuals, coordinating the services, improving individual success? Okay, so what I want you to be thinking about is what data points would help you with that. And then Robert is on this call. We'll share those with him and we can have a conversation around how can data help us make decisions locally. So the system blueprint represents what we believe in. Let me go back because I want to talk about this. Evidence-based practice is also important. This is from my perspective as working for a former funder. We're always looking to make sure that when I worked for the foundation, we were always looking for organizations that said, we have an evidence-based model. Because what we knew was they were more likely to be successful if they were following that evidence-based model. So although following evidence-based practice can be a challenge for smaller organizations, what we hope is that constellations of providers are working together to help smaller organizations come on board to doing evidence-based practice. And so that might be mentoring a larger organization with a smaller organization so that maybe the larger organization is maybe helping that smaller organization figure out how to take data that would give proof that it's following evidence-based practice. You know, that might be a model that would help bring more providers in and help raise the level of fidelity in your local community. But the thing about it is, community service providers and agencies who participate in collaboratives that are built around evidence-based practice are more likely to be able to produce clear evidence of the impact of their effort on the clients. And so if you can talk more distinctly and specifically about how your participation in this larger system is affecting individual client outcomes, then that makes you more attractive to funders and donors. It increases your bench strength for contributing to solving the problem. In other words, focusing on evidence-based practice increases the bench strength of staff in implementing evidence-based practice. And it also gives you better information for reporting to donors and funders. So really, evidence-based for evidence-based sake is important because you're going to get better outcomes. But the benefit to you as community coordinators who are engaging community agencies, this is another point of resistance. You can say, look, we're in a collective impact collaborative here, and we are going to have data that will be able to demonstrate the benefits of our collective impact. And that might help you overcome resistance or engage some folks who may not necessarily see the benefit. So the blueprint is what we believe in, and it is in your packet. If you would go ahead and take a look at that. And it's based on some values, accountability. So the expectation of results and measurable goals supports opportunities for rehabilitation, remains flexible to implement best practices, and maximizes employee potential. Fairness and integrity fosters a professional environment of trust through transparency, cooperation, collaboration, and respect for diversity. Innovation and technology. It uses data, analytics, and technical assistance to identify risks, needs, responses, and results to drive coordinated information sharing and enhance staff development and training. Sustainable safety. So programs and operations are based on solid processes and utilizing evidence-based principles that produce expected measurable performance outcomes. So those are the conditions that you're working to promote at all levels of the system. So that's kind of a checklist that you can use. And so the principles of evidence-based practice are to assess actuarial risks and needs, and the department does that. Another important piece of this is to enhance intrinsic motivation. So remember when we looked at the slide with the arrows on it? At each of those points, every time you or one of your providers or one of your parole officers or a transition specialist, every time they come in touch with that individual, they have an opportunity to stimulate that individual's intrinsic motivation for success. Now, what do I mean by that? What I mean by that is people cannot be successful unless they believe they can be successful. And in some cases, with my work in trauma, I would say they can't be successful unless they believe they deserve to be successful. And so, sorry, I'm letting some folks in. This is really, really, really important. There's all kinds of books out there about self-sabotage. So we have a very important opportunity every time we come in contact with that person to remind them that we see them as a human being with potential, and we believe in their ability to be successful. And we are here to bring all that we are to help that happen. And every person in every step of this process has an opportunity to instill and strengthen that belief in that individual. We know that somewhere along the lines of like 98% of individuals in prison have experienced 6 or more ACEs, adverse childhood experiences. and that those ACEs are highly correlated with incarceration. An individual with 4 or more adverse childhood experiences is 20 times more likely to be incarcerated and 10 times more likely to be an addict. And I can give you that the data citations for that if you want. So we are working with highly traumatized people, many of whom who have engaged in a lot of internal adaptation to very dysfunctional environments. And I think we have an important, really important job to remind them that they are human beings worthy of safety and connection, and to help educate our peers that every time we come into contact with them, we can give them that message. And that contributes ultimately to their ongoing success. So other parts of this, and this is in the evidence-based model, and you guys know, because I think you've probably all taken the REAP training, or most of you have, that we're targeting interventions based on the risk principle, the need principle, and the responsivity principle. I think right now, risk and need are being addressed. I think responsivity is aspirational. And responsivity is, what about that individual? And it's kind of what I just talked about. What about that individual makes them responsive to whatever it is that we're trying to deliver to them? It could be something like the belief that they deserve to be successful. And it could be something like their educational attainment or their literacy level, right? So those things can affect how they can receive what we are trying to deliver to them. The actuarial risks and needs is all part of the TIGER process and the REAP process. But I'm not the data specialist. We have Robert on here. If I need to say more about that, or I didn't properly frame that, I'll make sure that Robert gives me the correct explanation, and we send that out to you to make sure that I'm giving you the correct information about the TIGER and the REAP. So the other aspect is dosage. So we really, when you're creating these individualized case plans, you want to structure 40 to 70% of high-risk clients' times for 3 to 9 months after they get out. So that individual case plan can go beyond where are you going to get housing, employment, and all that. What is your action plan to be successful over time? It's kind of like a life plan, right? What time are you going to go to sleep? How are you going to get to work? You know, what if you're in an OJT situation with WIOA funds and that runs out in 10 weeks, what's your plan to get a job when that is over, right? Are you going to come back and meet with me so we can make sure we keep you employed? That kind of thing. Treatment, so integrating treatment into sentence and sanction requirements. Skill training with directed practice and cognitive behavioral methods. Increasing positive reinforcement over negative. Engage ongoing support in natural communities. So Julie talked about the neighborhoods, right? I had an idea. I don't know how feasible it is, but I was like, what if we could have a fellowship or a homecoming at a local church when someone comes home, and we have folks come who are willing to offer their support and say, hey, if you need help setting up a bank account, I'll help you do that. And hey, if you need to balance that check account, or you need the fuel filter changed on your car or whatever, I'm in your neighborhood and I'm here to help you do that. Here's my phone number, give me a call. So, you know, creating those natural community connections to support them when they come back to their neighborhoods. And again, it's really important, and the department is doing a great job of expanding what's being measured, but constantly being attuned to what data do we need to be able to tweak our system and improve it over time. So rational planning relies a lot on the decisions made by the team about the information that they will gather. So think about it. These assessments that we're going to talk about at the end of this session are how you're going to figure out where you are. It's a great tool with some checklists. Where are we? And then you can use what we've talked about to decide what comes next. What are the next 1 or 2 steps that we can move toward the ideal, right? But information should always drive decision-making. And that is also an opportunity for messaging, right? For engagement, for getting people to the table around the shared vision and getting consensus. Do they agree? If you've collected data, do they agree that the work is where you say it is? Take their feedback and tweak that until you have consensus. Yes, we all agree this is where we are. We all agree these are the next 2 or 3 steps that we can take to move closer to the ideal on this element of the work that we're trying to do. So you have comprehensive data about the system as a whole. You have a system map, which we're going to be talking about, that will demonstrate the process of the case from intake through discharge from supervision. And similar information is going to help conduct that gaps analysis that I'm talking about. That's going to help you get into priority setting. And we'll cover the system map next. So what are we talking about? We're talking about information and data gathering and sharing, and that is a continual process. So I want you to be thinking about, in my day-to-day stuff, where am I receiving data? How am I using it to improve what we're doing? And how am I messaging that data to my stakeholders so that they're on board with what we're trying to accomplish? And the department is becoming clearer over time about what data needs to be collected. The data committee gave us a beautiful snapshot of a dashboard, and they invited us to let them know what are the things that we need that they can pull together that will help us improve the system. And so they are working on how it will be reported, how it will be stored, how it will be distributed to communicate progress and impact at different levels. I think that Andrea also talked on Wednesday about the fact that there are ways to break that down to your local jurisdiction. So there's state level data, but then you're going to have local data to your jurisdiction. So the LAPRR case logic model is also a really cool document. It's got beautiful colors, one of which is purple. So it really is one of my favorite documents in this set. It is in your packet. And I'd like you to go ahead and go to that. I think it's 71 in your packet. So how many of you have seen the case logic model? Okay, great. Awesome. How many of you have had it explained relative to the current efforts for change? Okay. So again, kitchen sink. If you already know this, my apologies. But we're going to tell you what we would like to tell new community coordinators. And then at the end, you can feed back to us and let us know, is this level of data useful to community coordinators? Now, I have to give you a caveat. The department does not endorse the use of numbers to describe iterations of the REAP over time because it's an online system. It's just a body of, it's a display in an online system that is what it is at the time that it's displayed. The department believes that you'll be able to identify where in the process that individual is, right? So where in the three-phase system, based on what other information is contained in the online system. And therefore, there's no need for numbers to describe at which point during the process the individual is. However, for the purposes of training and discussions about a sequential assessments occurring over time within the context of the three-phase system, we prefer to use the REAP with numbers for greater clarity for you, because that communicates more information about where in the theoretical model that individual is. But again, the department does not use this nomenclature or endorse that procedure. So the Louisiana Department of Public Safety Reentry System Map shows the proposed process of developing a 4-component reentry accountability plan from prison intake through discharge from supervision. The system map is called the case logic model, and it's embedded in the policy. There are 11 steps or sets of activities laid out in the case logic model. So take a look at that and follow along. Note that in the slide, we're talking about part 1, part 2, part 3. We're just referring to where those assessments take place in a sequential system, right? So step number 1, assess risk at prison intake for the prisoner's risk level and target those individuals who pose the highest risk for reoffending. Note that the model includes an allowance. This is important. An allowance to override the assessment results with the expectation that no more than 15% of the cases will have an override. This is to allow for the professional judgment to be taken into account when circumstances dictate that it should. For example, an individual may have several domestic assault arrests, but no convictions, often due to a spouse not following through on charges. So that would give the individual who's reviewing the fullness of the case to make a discretionary decision about what level of risk and need that individual has, but that margin to override is only by 15%. Considering the evidence-based practices of reserving limited resources for the highest risk, highest need cases, it's noteworthy that the department case logic model includes a default for lower risk cases, which are expected to receive less intensive services and programming while incarcerated. As you can see from the model, these cases are not expected to receive the services shown for higher risk cases. So these are two separate populations. Can anybody tell me why that is? Does anybody know why we don't provide a high level of services to low need, low risk populations?
Okay, so my understanding is that we can really make some people worse. You know, if we get a lot of the people, we require low risk, low need people to do a lot of things. We take them from their pro-social engagements and put them in the presence of higher risk and need people, and thus they make them worse. And so we want to avoid doing that.
That's exactly right. The research says, and I've got a whole presentation, it's actually on our website, I believe, that is about implementation fidelity and why we do it this way. The research says if you provide a high level of services to low need, low risk people, you create a dependency in them for those services that they did not previously have. So that's an important piece. And I think when you work in the community, people are going to need to understand that. That's an important point. So number 2, we're going to assess need and responsivity. We're going to administer validated needs assessment batteries to identify criminogenic needs and dynamic risk factors. Number 3, we're going to develop the institutional REAP Part 1, or as the department calls it, the REAP. We're going to utilize risk, need, and responsivity assessment results to develop that REAP, guiding the types and levels of services to address the needs while they're in custody. And the Tiger is used for this purpose and should drive the in-custody programs that the individual enrolls in. But this is easier said than done. Historically, in prisons across the country, there is not enough programming available for this high fidelity programming to match to the client need. Instead, in most prisons nationwide, there's more of a cookie cutter approach used by placing prisoners in programs that are simply available or chosen by staff, if for no other reason than to keep them busy. But here's the thing, that is not a poor decision to make, since prisoners who are not busy are more prone to inappropriate behaviors when they're in custody. But that practice is not evidence-based, meaning it hasn't been proven to reduce recidivism. So keep this in mind as the department moves toward the ideal, a very positive movement that will take a while to achieve. and not until significant additional funding is provided to fully meet this aspirational goal of effectively matching clients to evidence-based programs directly to their risk need requirements. That was a whole lot. Was it clear? Okay. It's all a work in progress, but the department is doing a tremendous job of working within the confines. And I don't know if you guys know, but there's no other state that I'm aware of that houses half its population in local jails. That's another added layer of complexity. But my understanding is that the regional reentry centers are working to help ameliorate the impact of that on the department's ability to line up needs and services in that way. Good job, Robert and Red. Number 4, so now delivering the programs while in custody, evidence-based and time management programs offer varying levels of dosage, duration, and intensity based on risk and need as well as idleness. So the example that I have from that, because when I was community coordinator in Jefferson for a while and I worked with Byron Williams and Keenan Dufashard down there, the model that they gave us was that low risk, low need people would receive 12 weeks of services, moderate risk, moderate need would receive 24 weeks of services, and high risk, high need would receive 36 weeks of services. And those different tiers of services would also be geared toward what their particular needs were and or what their vocational or employment capacities were. And so not everyone would get the behavioral health interventions. Obviously low risk, low need might not get those. So they had a really great plan for how to really get the dosage lined up with the risk and need requirements. And I haven't been to visit that, but that is the plan. That was the ideal. So, I mean, it's just the reality that most prisons just don't have enough resources to meet this evidence-based approach. And it's also important to note that idleness factor, meaning keeping people busy, does have some beneficial impacts. And so that is going to be part of how that in-custody program design happens. Number 5 is measure progress while in custody. So conduct periodic case reviews to evaluate progress, measure treatment gains and setbacks, and update the REAP accordingly within the context of housing assignments. So things that happen in prison, positives such as program completion, and negatives such as tickets for unacceptable behavior should be taken into account. Again, this is the ideal and to some extent aspirational, but having this expectation in the regulation is really important. And as time goes on, the department is going to be able to move closer and closer toward the ideal. Number 6 is review the reentry risk. So reassess individual risk level and target offenders who pose the highest risk for reoffending for specific services to address those needs and to help manage and reduce risk while they're in custody, right? Number 7, assess reentry needs and responsivity. So that's administering a needs assessment battery to identify criminogenic needs and dynamic risk factors that will be priorities at release, right? And so this is in order to create the second REAP component, which we call the REAP 2 and which the department calls the REAP, even though it's expected to be one evolving document, not separate documents. So some jurisdictions have a unique assessment tool to measure risk of reoffense and needs post-release rather than just risk of reoffense, which is what the Tiger does. Over time, this may be possible once the Tiger is fully implemented. For now, if prisoners have been incarcerated for long periods of time, a reassessment should take place. If the prisoner isn't incarcerated for more than a year or two, as most prisoners in the Louisiana system are, then a reassessment won't likely yield different results. So this, we're balancing the idea that, yes, we want to assess at a rate that makes sense so that we have a sense of how this person is responding to in-custody training and programs. But we also have to balance that with limitations on staff. And so how often that assessment takes place is going to be, affected by what is our capacity to administer those assessments, and how useful is it to do it at a certain frequency. I believe that the regulation actually has some metrics in there for sort of what the minimum standards are. And I believe it's probably annually or something along those lines, but we'll get to that in another module. Number 8 is release conditions. So the parole board reviews the case, it reviews the REEP-1, reviews the prisoner's progress while in prison, and makes a release decision with or without conditions, and assigns that case to a supervision level in order to create the REEP-2. If a prisoner is not being released on parole, there still may be release conditions made by the releasing institution or release expectations that were placed in the judicial order of sentence. Either way, the second component of the REEP should be documented, including a notation that there are no conditions of release if that's the case. And then number 9, begin reentry case supervision plan, which we are calling the REEP-3. So and I believe the jail transition specialists do this, but I'm not sure. So I'm going to put that, that's a question I'm going to ask Robert about that. Who does that? And it may differ from facility to facility, but review the case history, review their progress in prison. Like, how are they doing since they did the REEP-1 when they first came in? What are the parole conditions? What's in the REEP-2 for their programming? And add specific services to respond to individual risks and needs, parole conditions, community and family elements and opportunities in order to begin the REEP-3. This is the most prominent example of how things are or will be different under this new regulation. It's new since 2019, since the policy requires community input for post-release services. And you guys talked about how that process happens. Ideally, prisoners would be pre-enrolled or actually enrolled in the services before they get out. So there's no wait time or after release. And that goes to that keeping them busy plan for 6 to 9 months after they get out, which is a key part of helping them be successful and stop that revolving door. Pardon me a moment. So these services need to be front-loaded so that post-release schedule is super, super busy and allows little time for illegal or inappropriate behaviors and hanging out with the fellas at the corner. Since services often cannot be enrolled or pre-enrolled, this third component of the REEP can only be started while the prisoner is in custody, and then it's completed post-release. Obviously, COVID has made this really difficult, if not impossible to do. And so that represents the ideal. And you guys gave some great examples earlier about how you're kind of navigating some of that in these changing conditions. Okay, we're going to finish this slide and we're going to take a 10-minute break, a 10-minute bio break. So let me get through this and then we'll take a break. So number 10, finalize and implement the REEP-3 and monitor progress. So we got to complete the development of the REEP-3, the third component of the REEP that began prior to release from prison, and we adjust it pursuant to enrollment in additional services and programs using the rewards and sanctions policy and procedure, using coaching skills like motivational interviewing, telling them that we believe in them, right? Using that goal-centered dialogue. So case management is intended to follow the case supervision and management model that I mentioned earlier, and that's also embedded in the LAPR regulation. So if you wouldn't mind, go ahead and turn to the collaborative case supervision management page in your packet. It is one of the attachments to the regulation. It should be labeled for you in the bookmarks of the binder. The packet.
I think it's page 74.
Thank you, Judge. And then last but by no means least, number 11 is create a discharge and post-parole community REEP or community plan. So that's the develop a discharge report, a final REEP, and that's to hand the plan off to the community supervisors at the conclusion of parole supervision. And so discharge plans are already required in the department's parole process. But I want to point out this notion of a handoff with a specific fourth and final component of the REAP, which no longer has parole supervision involved. That's aspirational. It's very important to have that evidence-based practice in the policy for future development. And then 12, expectations from improved use of evidence-based practices, including actuarial risk and needs assessment, case planning, and use of the REAP are consistent with performance expectations of the Louisiana System Blueprint. And we'll be focusing on those in the next section after our break. For now, you'll find the System Blueprint in your training packet. And you can take a quick look at that. And we are going to take, it is 11:47. Let's come back at 12 o'clock. We'll have 30 minutes and we're gonna bring it on home in that 30 minutes. So go take a bio break. I'll see you guys back at 12 o'clock. Welcome back, everybody. And I just want to take this minute to thank you for sticking with me through all of this, because I know it's been a lot. I know it's been dense. I know it's a lot, but I just want to thank you for being patient, sticking with me. So here we are. We've got a half hour left. And so I've got some slides. We're going to just run through those, because what I really want to get to is how is this going to help you when you get back to your jurisdiction? And that's really what's important, right? Some of these things we're going to do a deeper dive on in the other modules, but we're circling back to this idea that the community planning process and the sort of cat herding process that you are the steward of in your community around this work really boils down to a couple of things. And so that might make it easier to think about. It's about helping the community set priorities and measuring progress, right? So if you can think about, if you can organize kind of the processes and the tasks that would happen under that, those are those overarching ideas, those overarching themes. And so you're going to want to think about, how does your jurisdiction identify and prioritize action items? Teams may have limited capacity to address complicated issues. I know that you guys have all participated in creating a community needs assessment, right? That captured assets, barriers, and gaps, and proposed solutions. But the next step of that process is to organize that into an action plan or a work plan. And I don't know about you, but what I find is, people are very busy. But if they're taking the time to show up and help you do this work, it's more comfortable for them to have clear expectations about how you believe they can contribute to the work, or to get their input on how they believe they can contribute to the work. And so that keeps them engaged. If they've got activities, if they've got to come and report out about the committee meeting that they had in between the larger meeting, or they say, hey, I want to pull the housing committee together. Can you send an email out to everybody that has anything to do with housing, and let's get together and come up with a list of everything that's going on in the community right now. Or maybe you can find a group of people who are working with a special population around housing. And can we talk about that? So, you know, and that process happens by constantly saying and assessing, where are we right now? Where do we want to be? And what are the steps that we can take to get there? So we can be effective planners, but we will not achieve the end goals if we're not also measuring our progress and adjusting and tweaking that process. So I just very briefly want to point to this excerpt from the Louisiana Prison Reentry Regulation, which is in your packet. And its purpose is to promote public safety strategies focused on the reduction of recidivism and consequently the reduction of victimization, stabilization of the growth of prison beds, and the lowering of the size and cost of the state's justice system. And I think we heard the secretary say on Wednesday, that was like $138 million. That's huge. So the goal of the initiative is to promote public safety, increase the success rates of offenders, and advocate for reinvestment of a significant portion of any savings that comes from implementing this work back into programming and services and other resources. The other thing I want to talk to you about is the RAC strategic plan. So we looked at those two tiered bodies. The Reentry Advisory Council has a RAC strategic plan. So if we want to think about what is the highest level of policy plan for our state, it lives there. And it's available on the website. If you want the link, I can send it to you. And it's just available under the Boards and Commissions website under the, it's under documents or reports or statutes or something like that. But that the current RAC strategic plan is there. And so if you want to think about what does the RAC believe its body of work is to contribute to supporting all the work that you're doing on the ground, it lives there. Anybody have any questions about that? Okay, so I'm not going to go into detail with these slides because these are about process and impact expectations. But the important part I want you to take away from this is you have in your packet everything that you need to know what the ideal is, right? So you have the ideal. Your job is to use those tools to help you assess where your community is and help move your community in the direction of the ideal. So when I was a community coordinator, anytime I would sit down and go sit at my desk and be like, whoo, I got that meeting done, now what? Right? Then you can come back to these tools and say, what's next on the list that we're trying to achieve? And how can I take an opportunity to assess where we are and what we need to do to take the next one or two steps toward the ideal? So these data points are all in there. I'm not going to revisit those, but these are also data points that you can use, that your community organizations can use to talk to their donors and their funders and their board members and the public, the members from the public that volunteer for their organizations. These are indicators that help tell the story of the impact of what we are doing together. Effective case management is another piece, and we have a whole module on that. So I'm not going to go into this, but what's the only part that I want to make is that supervision purely for surveillance has been proven is not effective in improving reentry success. What is effective is community supervision that is tied to treatment interventions. And so that is actually what's happening. I know in Jefferson, when I was there, they were talking about getting the probation and parole officers to come and staff the cases, and they were very much focused on avoiding revocations. It's not we got you, you got to go back. It is our job is to help you stay out. And I think that is a key shift in the paradigm coming from the top down that has helped contribute to the significant reduction. I think I said 38% reduction in new admissions due to technical revocations. Actuarial risk and need assessment is what's happening with the Tiger and the REET. And you guys are very familiar with the medium to high risks that are being prioritized. This is some information around how you organize the programs and services to fall in under the principles of evidence-based practice. Again, going back to that positive interaction with clients, right? Success-driven supervision balances monitoring and accountability with other activities. Being the helper to that person to identify where they need support and getting that support to them is what helps them be successful. I know a lot of you guys are experienced case managers, but when you're thinking about where can we build our skill set, our bench strength for the people who are sitting around the table to do this case planning, this may offer you opportunities to help increase that bench strength locally and help round out skill sets for your case managers. These are successful case management techniques. You guys already know a lot of these. If you're like, hey, what can I do better? Maybe something in this list might offer an opportunity for professional development to help you get that skill level up a little bit. And some additional resources. So these are all in your coaching package. You don't need to remember this. All right. So what I want to do is we're going to jump away from the slide deck and we're going to go into the packet. So bear with me as I navigate the command center to make that happen. Hold on. Make it so, number one. I think I'm going to have to stop the sharing. And then we'll have to go into this. Okay. Can everybody see my screen okay? Here, let's get that down to a page. So that is page 27 in your packet. And I've got to be able to see the slide. So hold on. Thank you for being present with me as I learn new things and patient. So what we've got is a checklist that you can use that will help you sort of think about all the things that we've talked about in this training. Now, some of these things are going to be at the policy level and at the state level in the state structures, right? So they may not necessarily apply to you locally, but you might want to ask yourself, how do I connect in to know if this is happening outside my jurisdiction? Okay, so let's look at the process really is that you're going to go through and rate each item in the checklist, yes, no, or not clear. For the items where your response is not clear, you're going to make note of the additional information that the team needs to collect in order to be able to rate this item. Additional items can be added to relate to your jurisdiction's implementation of the framework that's not already on the checklist. So this is not the be all end all. You have and should add anything that you take away from what we talked about today that you think your team needs to do in order to be engaging in that rational planning process and having that cycle of setting priorities and measuring progress. Setting priorities, measuring progress, right? You're the fulcrum in your community to help your community engage in this process and to improve its process infidelity over time. So what you want to do is develop a consensus-based response for each item on the checklist. Once the checklist is completed, consider your jurisdiction's strengths in implementing such an approach. and make note of those, right? Those are some of your assets that can go into your community needs assessment. Next, consider your most significant gaps and make note of those. All right, so does anybody have any ideas about how you could do this process in a to build consensus around it? Anybody have ideas, creativity, inspiration? How are you building consensus in your local jurisdiction now around shared action or shared vision?
So just to kind of follow up, it would seem like that after the community coordinator has done the individual work of using this checklist, that that coordinator should share his or her opinions that are recorded on the checklist with the remaining members of the team and solicit feedback. Do you see it this way, or you see it a little differently? Should this be scored a little differently? And after that kind of a meeting, everybody on the team would be on the same page.
That's a great example. Anybody else have anything different?
No, I think in complement to what Judge Edwards mentioned, is just making them part of that process. Maybe having their voices included onto what they think is on the best interest, and steer that conversation towards solution oriented and action steps onto what can we really do to get involved. In order for somebody to criticize, or not necessarily to criticize, but to build upon somebody's concept of reintegration, they need to be part of that process. And if they feel validated, they feel included, it's easier for them to feel like that not only their opinion matters, but their presence and on the table will matter, and it will make a difference. They have to be part of an active participant of that process.
Absolutely. Thank you, Tatiana. And think about too how you can invite people to weigh in and ask questions and educate them, because here's the four corners of what we're trying to do. So it becomes an educational and engagement process, even as they feel like they are contributing to the work. So you can you can get a lot of birds with that stone by using a collaborative process and gathering them around, maybe at the end of a meeting where you've taken these slides and you've adapted them and you've given your community only some of the utensils out of the kitchen sink, because they may or may not need all of this. You know, what's their what's their bandwidth to receive, and what dosage of this information do they need to feel engaged in order to come around a collaborative planning process. And you take these slides and you do that, you present that, then you give them this checklist, and they're weighing in to drive this action planning process. So that is absolutely perfect. Perfect, perfect, perfect. So the bottom line then is, or not the bottom line, but the next step really is you and your team can look at what you've pulled together here and determine, based on what you've read, what you've discussed, the feedback that you've gotten, where do you desire to advance your jurisdiction's work with regard to implementing the framework, considering the work that's already being done, right? So the things that we've already got that, there's going to be some things left that need work. How do we move the needle and toward the ideal on that? If you decide that you have a desire to improve in this area, then you can pull together an action plan. So this is just a sample, but you can use a worksheet similar to what's up on the screen, and you can help write this comprehensive community reentry plan that is going to operationalize an evidence-based framework for reentry and is customized to the specific needs that you built around consensus based on input from your stakeholders. Doesn't that feel beautiful? Doesn't that feel amazing? It's really very organized to my little OCD heart, right? So it's just sort of step one, step two, step three. And then that becomes a body of work that you can come back and revisit and say, here's where I think we are. Everybody weigh in. So prioritize the work, measure the progress. And here's another piece. This is not in there anywhere, but celebrate the progress. Make a big deal when you hit the metric on some of these things, because I think with a problem this big, it's real easy to get caught up in what's not getting done. We got to celebrate and be community for each other and be like, heck yeah, look, we hit the mark. We have got a comprehensive plan in place. We've got, you know, whatever that metric is. My dad always said, plan your work and work your plan, right? So I think that's a Zig Ziglar quote. All right. So once you have the list, identify 3 most significant strengths in this area and discuss how you might build on those. So that's leveraging the assets. How can you take what's already here and what activities, what resources, what investments would help us expand assets we already have to better serve the community, right? Then you're going to identify your 3 most significant gaps. For each gap, write an objective. Your objectives might be conduct a team retreat to discuss joint goals and objectives for reentry. It might be conduct a gap analysis to determine where our practices diverge from evidence-based principles, or something else. Whatever is a priority to your community to move that work. You can put your objectives on the action planning worksheet. And then you're going to map it out. You're going to, what I call, operationalize it. Right? Set out in great detail the specific sequential steps needed to meet the objective. Assign a person to take ownership of that objective, right? Ownership is really, really important. And then a completion date for this action item. It doesn't mean you can't change that completion date, but it gives you a target, right? And it gives you a place to check in. The other thing that you may need to consider, and so this action planning worksheet is just a form. You're probably going to need something a little bigger. We have a form that you might be able to use for that, and we'll talk about that later. But you're going to need to ask yourself, what additional assistance or outside expertise does the team need to achieve the action items? Right? Do you need more skill building? Do you need a training? Do you need a partnership? Do you need a collaboration? Do you need a work group to help break out what the tasks are, right? What do you need to take these things we've identified and break it down into actionable steps on a to-do list that we can check off with an owner and a deadline? All right. And it also could be, do you want to reach out to another practitioner or a community coordinator who you know has been getting really good results? Or do you need some other kind of assistance, right? I think in this group, we have brilliant, inspirational, innovative rock stars who have been breaking new ground. I call it standing at the edge of the Amazon with a machete, you know, just clearing new ground, doing all new things. Your job didn't even exist a few years ago. So you're all innovators in this space and you've all been doing it. And you've got important experience tied to your successes that you can share with the rest of the group. And I know you guys do that, but really strengthening this community of practice so that it is really about sharing the wins and assessing that against evidence-based practice and getting everybody up in that fidelity of consistent standardized practice is all part of supporting each other in the work. So for each action, for each action item, determine what expertise you need, prioritize it, right? So you've got to go back and say, we're going to do number 1, number 2, number 3, and then make the plan to get the expertise that you need. And we're going to work with the department on where we can maybe help with some of this, provide some support with this. We're taking their lead on how they'd like us to weave into what they're already doing to support you. So we are nearing the end. We have 8 minutes. So I want to open it up for questions. And here, let me stop the share. We're going to go back to the slide deck. And so let's take a few minutes. Any questions?
I don't have any questions, but I do have a comment.
Okay.
One thing that I'm learning about today, and I can't speak, I'm speaking from just myself, is truly collecting data and assessing your individual area. I was with the model in mind, but in order to truly implement the model to better serve your clients and your customers so that they can truly be a success. So that's one thing that I truly learned by listening to this training, is something that I didn't have in my toolbox before, that I am going to implement it moving forward.
Thank you so much, Sherry. Then my work here is done. We've accomplished some things. Was there anything in here that was particularly useful? Well, I'm going to ask you in your evaluation, what was the most fun? So I
Your
realize the bar on that
personality.
is going to be pretty low.
Your personality, that's always the best. No, Ronnie, I think that all the structure is just restructuring the job and the work that we already do and shaping up. I think all of those forms and that the way you disseminate it, giving a new meaning to what we're doing is just redefining the level of work or the intensity, which I assume that now we're going to be utilizing those forms in a very close manner. Was I correct? Assume? Yeah.
Yeah. Yes. Yes. Yes.
Gotcha.
Well, and then these are just tools for you. You don't have to use this, but these are the kinds of things that we heard when we went out and met with you about ways that would make your job easier, make the path clear. Because like I said, you guys are innovators. You guys are creating this from scratch for Louisiana and then customizing it to your unique jurisdictional culture. And so what I want you to know is you're not alone, and we are here to support your success. I think you guys are fabulous, total rock stars. Anybody asks me about Louisiana community coordinators, they are knocking it out of the park. They are powerful. They are leading. They are helping us get this work right. And I am just so very grateful for everything that you bring to your job every day, all that you are, all of your creativity, all of your initiative. And I know that everybody else in the work is grateful that you're here at the fulcrum, right? At the core, you're here and everything is balancing around you and your ability to herd these cats, because I know it feels like herding cats sometimes. But I just hope that this has been useful. I understand some of it is duplication and may have been redundant and didn't help you as much, but I hope that the time that you committed gave you enough support and enough information that you feel like it was well worth your time. And I encourage you, the feedback forms are anonymous. We're going to share that data with the state because they want to know how effective we're being and helping to organize around this work. And be candid. There is no comment that is not welcome, no matter what. I am open for constructive comment. And we'll be talking with you guys to help us, continue to refine this as a useful tool for the broader initiative. So, yes, Judge, go ahead.
I know that we're wrapping up. I have two observations. One is that I know that the community coordinators meet on a regular basis in sort of a structured format. However, I also believe that each of the community coordinators have each other's email addresses. And so I would encourage you to, as you digest this information and review the packet that was emailed with that you consider communicating with one another and asking, how are you doing this? Or if you feel that you're particularly successful in a given area, share that with the other community coordinators. It may be that today you're a little hesitant to have those kind of sharings with folks who are not in your role, but amongst yourselves, please do share that information. Secondly, I think that this presentation can help you organize in your mind a way for you to systematize the onboarding of new members of your team, right? So that you have a playbook in mind. Whenever a new person comes into your team, you'll be able to present them with the same information, and so that everybody is up to speed and on board. Those are my two observations. Thank you, Vonnie, for a wonderful training.
Thank you, Judge. I think that was a really nice cherry on the sundae of this training. And I also want to give a shout out to my dogs who did not bark once this whole 3.5 hours, which is pretty rare. So I'm available. You have my email. I will send you this link. Don't worry about copying it off the thing. I will, as registrants, I'll send you a follow-up with the link to the evaluation. The evaluation is so important. Please give me your candid feedback. And if you have not registered for the other sessions, please do so. I will send out a reminder probably this weekend or maybe Monday with the links to register for the other sessions. And if you get me your feedback, I will use that before I present the next one. So we continue to constantly sharpen the blade of how we're engaging you, supporting you, and celebrating and cheering you as we go through this journey together. So this has been my privilege and my honor to spend time with you here today. I just want to wrap you in beautiful energy. Thank you for your gifts of talent and contributions to your communities. And I look forward to working with you in the future. Thank you so much.
Thank you. It was wonderful.
Thank you so much. Y'all take care. Have a great weekend.
Have a great one.
Thank you.